on all endeavors to confront this coronavirus pneumonia. Since the outbreak, the medical workers has been working day and night, and regardless of the risk that they are taking. And there are many touching stories emerging. Jingtan Hospital is the hospital that admitted the more severe cases than any other hospitals in Wuhan. The president of the hospital was Mr. Zhang, who is himself an ALS patient. And he continued to work and in his position despite his condition. The doctors and nurses have been contributing so much, and because of time constraint, I cannot tell their stories one by one. And so far, in all of the hospitals, we have designated hospitals that open up a fever clinic, and we have also changed the general wards into infection disease wards after renovation. Right now, in 24 designated hospitals are receiving fever patients. It is only possible without the renovation so that the hospital wards can meet the standard of treating infectious disease patients.
有42支医疗队，医护人员4599人，其中解放军医疗队3支，人员450人，医护人员151人，全省自治区直辖市36支。所以一共呢，驰援我们的医疗队是42支。这次机会奋战在武汉疫情防控第一线的，表示衷心的感谢和崇高的敬意。部分征用医院按照传染病医院的标准改造完成，和按照小汤山的模式建设。
After the 2 prefab hospitals were finished, we will be able to devote more medical resources into the prevention, control, and treatment. After the city was shut down, in order to ensure the basic daily necessities of the residents, we have motivated resources from many aspects to guarantee market supply. So far, the market supply remains stable. In terms of enterprises, Dongshan and Carrefour and Hema, Rawson and the other and another 110 major markets are open and in business. The gas stations are also working as normal, and we have abundant reserve in terms of oil and gas. The drugstores are also in business so as to facilitate the residents' purchase, but we are under short supply in terms of alcohol, masks, and other sterilization tools. To address these problems, we have opened up green channels to ensure the supply of grocery, including vegetable, meat, egg, and other groceries. We have also opened up reserves to guarantee the supply during the Spring Festival season. We have also strengthened market supervision and our crackdown malpractices, especially the abnormal raise of prices. After the Spring Festival, the manufacturers will slowly begin to restore their production. I believe that the undersupply situation would be addressed in no time. Currently, we have a sufficient supply in vegetables and other major commodities. This morning, the governor also have supervised one of the supermarkets and have understood and have getting to know the situation of green leaves vegetables. That's all I have to brief today. Thank you, Mr. Zhou. Now the floor is open to questions. Before asking a question, please identify yourself.
我是人民日报记者，我想请问一下，目前武汉防治新型肺炎的救治工作开展情况是如何的？谢谢。
Can you brief us on the treatment and prevention of pneumonia?
目前呢，我们正按照集中患者、集中
Currently, we have collective our resources and carry out collective treatment in designated hospitals of the patients. As of 20. As of yesterday, the total number of patients confirmed in our city is 2,639, among which 103 were cured. And for the residents that is experiencing fever, we have to do the screening so as to determine whether to send this patient to the fever clinic or ask him or her to stay at home for observation. Second, this early isolation has also been exercised. In 61 hospitals, we have established a fever clinic in order to deal with the condition of our patients and facilitate the medical service for local residents. We are determined to discover the suspected cases as soon as we can and give a speedy diagnosis so as to determine whether to keep the patient in the hospital or let him or her go home for self-isolation. We also have issued altogether 4 editions of a diagnosis and treatment plan and increased the number of beds and speed up the diagnosis process for suspected cases. You all know about nucleic acid test. After the optimization of our treatment plan, we have further sped up the process of diagnosis. After this diagnosis testing, we can quickly determine whether the suspected cases can be confirmed. You can now do this at the fever clinics. Once we further speed up this process, I believe that the medical resources would be utilized in a more proper manner, and we can exclude the novel coronavirus patients sooner than now. So in terms of treatment, we use the combined treatment of Chinese traditional medicine as well as antivirus drugs. Now we have a lot of patients that have been discharged. Many of them are from different age groups. Even some severe cases after treatment was already discharged. In the Jingtan Hospital and Pulmonary Hospital of our city, we also have renovated 24 more hospitals, and after careful evaluation, 23 of these renovated hospitals have passed the standard, and right now they have been renovated into designated hospitals to treat their patients. Today we have identified the 4 groups of hospital as a specialized hospital to treat fever patients. With Hubei TV, we have issued this prevention and control measures to treat nCoV pneumonia. So, what are the considerations of compiling such measure? The compilation of this method is mainly based on 3 considerations. First is to carry through General Secretary Xi Jinping's important instructions, as well as the deployment of the Central Party Committee and the central government. We will continue to strengthen leadership and unified command and unified action, and carry out prevention treatment in a scientific method, a scientific way. And second is to provide a constitutional guarantee for action. Right now, we're still facing very complex situation. In order to do this more efficiently, we have to have a mechanism and institution to guarantee the smooth operation of all of these links. And third, we compile this measure to address some of the mistakes or loopholes in our work. In the early time, we have issued many policies, including policy control and distribution of medical resources and so on. But people are now very concerned about the protection of medical staff, the distribution of medical resources, and collective prevention and control. That's why we have to further optimize our workflow. After making conclusion of the experiences in the first stage, and based on the general regulations of epidemiology, we will continue to further standardize our emergency treatment. with the Economic Daily. Can you brief us on the progress of the construction of the two prefab hospitals, the Huoshensheng Hospital and Leishenshen Hospital are two Xiaotenshen model hospitals. They are constructed according to wartime hospital standard. Right now, our construction workers are racing against time and speed up the construction in order to push forward the process so that they can be completed in time. Take Huoshensheng Hospital for example. The constructed space is about 34,000 square meters with about 1,000 hospital beds, and it will be finished on October the 2nd. February the 3rd, it will officially admit patients. Leishenshan Hospital has a floor space, a construction space of 75,000 square meters with more than 1,500 hospital beds. This hospital will be finished on October the 5th and began to admit patients on February the 6th. With Hubei Daily. Can you tell us about the supply of daily necessities, especially grocery, and what are the price regulation in the major farm market in Wuhan? Thank you. In terms of daily necessities and grocery supply, currently the supply of oil, staples, vegetables, and other daily necessities are having a balanced supply that can meet the demand of all the city residents. And you asked especially about the supply of granaries. This is a very important question because the green leaves, vegetables, are very easy to rot. They're not very good for preservation. So the preservation of vegetables is conducted through dynamic storage. We have mainly 3 channels for vegetables. First is Baisha and Shijing, these 2 wholesale markets. As of yesterday, this dynamic storage of these 2 markets is 530 tons of vegetables, and our governor have visited these 2 markets this morning. In 90% of the farm markets in the city have suspended their business during the spring holiday, so the major supermarkets in Wuhan have become a major source of purchase for our residents. As of yesterday, the total supply of these supermarkets is 2,100 tons of vegetables. And total production of vegetable is 46.54 tons, and the total amount of supply that can be picked up is 19,000 tons, and the total aid we have received has amounted to 8,500 tons. I think add all of that together, we have sufficient supplies to last a week, to meet the demand for a week. So that's more than sufficient for now. In order to ensure the sufficient and sustained supply of vegetables, we'll be also taking measures to make full use of the coordinating power of the MOFCOM in order to further improve the category as well as increase the quality and quantity of the vegetable. In terms of daily necessity, we would also give authorization to the vehicles that transport these daily necessities. After careful evaluation, we also would open second-tier farm market to improve the supply. We will make full use of the local vegetable supply and give subsidies to the vegetable storage. And in these two wholesale markets, we will be also give preferential policies to reduce the transaction fee in order to boost the transaction of the vegetable market. During the Spring Festival, almost all of the farm markets have closed down for the holiday. During this time, our main work are threefold. First is to clean up and sterilize these locations so as to make sure that the operator of these markets are urged to maintain the hygiene of these markets. And second is to strengthen market supervision and implement relevant measures to preventing and control of the nCoV pneumonia. We also would conduct standardized renovation of farm markets so as to upgrade these markets. Since the 23rd, we have continuously improved the supervision of these farm markets. Altogether, 90 to 100 person time have been conducting this business, this farm market, and have checked more than 16,000 restaurant and caterers, and have also checked up 6,100 units of food providers, and have cracked down 4 illegal cases. In this way, we continue to crack down other malpractices, including hoarding and the illegal raise of prices. We have cracked down 35 cases, among which 14 are administrative punishment. As of now, the basic supply and the markets are sufficient and the price remains stable.
下面接着提问。好，第二排。
你好，我是中国日报的记者。我们这个
With China Daily,
武汉市现在的药店就是开门营业的情况是怎么样？然后武汉市
I would like to know more about the operation of the drugstores and their business situation.
这个问题还是请徐红兰女士回答。
谢谢你的提问。这个根据这个今天的
Thank you.
统计，全市
According to available statistics of
开
today,
门营业的药店，这个是4084家，达到了我们
stores in business amounted to 4,084. 84 accounts for 85% of the total pharmacies in city, which make it possible for citizens, for the residents to purchase the drugs that they need in nearby drugstores. There are 6 major chain store pharmacies and Tongji-Tang, 老百姓 drugstore. And these are chain stores. And we have monitored these stores closely. We found that we still find a shortage in terms of alcohol and sterilization tools as well as masks. We are trying to take measures to mobilize the headquarters of these chain stores to procure out of the province. That's something we've been doing for several days now. We have been talking to the general manager of these chain stores. We also have talked to big drug enterprises to allocate their supply so as to facilitate the purchase of our residents. We have talked to Zhou Zhoutong and asked him to transport part of the mask storage and stock to the chain stores. We also have bring access to the transportation of medical materials. In this whole province, medical materials such as masks and alcohol and sterilization tools materials are under short supply, and we have received a lot of support from all walks of life. And please continue your support and assistance to us. Since the outbreak of the epidemic, you have received a lot of donations. So can you tell us more about the donation and how are these donations utilized? We have received a lot of donation. We have received a lot of donations and assistance from all walks of life, which provide us with massive help to our efforts, to which we are most grateful. According to relevant laws and regulations, and the fourth announcement made by the commanding center for fighting this epidemic, the Wuhan Charity Foundation and Red Cross are mainly in charge of the distribution and handling of these resources. We have made public our bank account, the receiver of these donations, as well as other information. We mainly have 2 ways. The first form is this kind of designated donation, and we would make sure that the donation goes to a designated institution. And second is non-designated donation, and this part of the materials will go to the headquarters for distribution. As of Charity Federation, we have altogether received 258,000 25 billion RMB, and it has already issued the first batch of utilization, and the second part of this donation's utilization will also be made public. For the Red Cross, it has received 27 donations, and altogether there are more than 9,000 cases of masks and more than 75,000 protective suits, and along with other protection materials. They will be allocated in a unified manner. And the Red Cross have received about 600 million RMB, and so far about 100 million RMB were used. And further, coming up, we will continue to keep this process transparent and disclose the details. And we are looking forward to your further support and supervision in this regard.
After
receiving such large amount of donation of a Red Cross, we are still running under supply in major designated hospitals. The Red Cross is an important channel to make sure of the supply in this prevention and control of the epidemic. There are multiple reasons for your question. First is that consumption has surpassed supply, which is very important. On its website, the Red Cross has disclosed the details as to what kind of materials that it's in dire need. Of course, we also have some problems in our work. For example, we have to improve the process so as to make the whole procedure more efficient. With Hubei's Voice, what are the community prevention control measures, and what are the provincial policies to support the community workers? In order to fight this war, and the community level organs is the foundation for the prevention and control. So we talk about the early identification, reporting, isolation, and diagnosis and treatment. The first three earlies would need the cooperation and work of the community level service. First of all, the community administration have to do publicity and educate the public of the knowledge about this disease so as to eliminate panic emotions. We have also taken multiple measures, including sending out brochures, or through WeChat, or through loudspeakers at the community and WeChat group, to inform the people of the important information. But this kind of work needs to continue. And second is to do screening of fever patients. Early identification and reporting is important for early isolation and treatment. We have issued notice and made standard and have given instructions and supervision. Right now, we have already finished the screening of 900 patients for a day, and in total, we have screened more than 21,000 residents. And right now, about 12,000 residents are still kept at home for medical observation. We also make documents to ensure better management and administrations. And for these patients who are quarantined at home, mainly the close contacts, and we would assign special personnel to supervise this process. And right now, more than 4,000 beds in hospitals were allocated for collective medical observation in these places. We also have employed medical staff. And fourth, we carry out the social aid. On the 24th, we have issued measures to ensure the basic living condition of vulnerable groups. Namely, for those who have difficult living condition, we would send for free dinners and drugs as well as vegetables to them. For those extremely vulnerable population, we provide them with necessary drugs, including TCM and Western medicine. We have also started this service of social cabs. We planned to summon 6,000 social cabs for the administration of the community, providing services to those those vulnerable groups living in the community. For example, for some people who are suffering from kidney disease, and also some of the vulnerable groups who have difficulty handling their own daily affairs. These social workers are working very hard because their work has been massive, and most of them are working overload. They barely have any time to rest. And a lot of the administrators actually live in these living quarters and communities. We must provide them with necessary assistance. And currently, to be frankly, we're not doing enough. We're right now trying to provide them with more materials such as masks and disinfectants. They are also working at the front line and fighting alongside with our medical workers. That's all for today's Q&A session. I want to thank our speakers as well as our friends from the press.